I'm Tom Hillhouse, the Vice President of the Uray County Historical Society, and I want to thank you all for coming to this season's last Evenings of History program, which I'm sure you will enjoy. It's not going to be our last event, but it is our last Evenings of History program. We've got 3 events coming up that you may want to take into account. This Friday, the 30th, there's going to be a cemetery tour out at Cedar Hill. If you're interested, it's at 9 o'clock, it costs $10, and you meet at the cemetery. And Alice Sleeper will be the guide. And if you wanted to know about some of the old folks of Uray that are no longer with us, it's a good opportunity to do so. Also coming up, we have some Jeep tours in Red Mountain. We think we have the dates pegged down, but given San Miguel and the Forest Service and the Highway Department, they could change. The first one is Saturday, August 14th. It's from 9 to 3, and they're led by our curator, Don Paulson. They're $50. Bring your lunch and pack for the weather. As you know, Don is quite the expert on the mines and the history of the area, so you'll be in for a real treat. That's the first one on Saturday, the 14th of August, from 9 to 3. And the second one is Friday, September the 3rd, from 9 to 3. So if you're interested, they're $50. You can reserve your place at the museum, and you meet at the museum, and you'll have a wonderful day. And our last event hasn't really come together totally yet, but it will. It is scheduled, and it's our 50th anniversary of the Uray County Historical Society. It's going to be right here at the it'll be right here at the Wright Opera House, and you'll be getting more information about that. We're sorry, you folks that take off and don't spend the entire year with us, but we just couldn't fit it into our schedule in order to get it done this summer. So we're sorry about that, but we'll see if we can't make it up next year. Our speaker tonight is Kevin Chismire. Kevin is the president of our society, and he's a retired ophthalmologist, having spent most of his last few years in Montrose practicing ophthalmology. He's a graduate of Notre Dame and the University of Kansas Medical Center. He spent most of his 30-year career in the U.S. Army, serving as a Special Forces battalion surgeon in Germany and serving on the staff of the Madigan Army Medical Center in Tacoma, Washington, where he also taught at the University of Washington Medical School. Kevin's a specialist in the field of glaucoma, having conducted extensive research on the disorder. Kevin moved to Ridgeway in 2002 and enjoyed running, biking, and of course, the study of the history of the Southwest. I know no better person to speak on tonight's topic, the 1918 Spanish flu. Kevin?
Can everybody hear me okay? I've got the earpiece, so if you can hear me, that's great. Anybody can't? Raise their hand. Okay, that sounds good. Thank you so much for that nice introduction, Tom. And it is saddening that this is our last evening of history for this summer, but I'm sure we're going to have a great slate, you know, for next summer, and I want you to all, you know, sign up and bring your friends if you can. You know, it was about a year ago that Don Paulson came to me and said, Kevin, I need some people to speak for the Evenings of History because it looks like it's going to be a go for the summer of 2021. So I said, geez, Don, I don't have a topic. Let me think. Let me find something that's obscure, that's something nobody's heard about, that is totally out of the consciousness of everybody who's going to be in the audience. Let me talk about pandemics. So that's what we're going to talk about. I bet you if everybody in the audience had $10 for every time they heard the word pandemic over the last 2 years, we'd all be millionaires by now. But we can learn something from history. You know, our pandemic that we are all suffering through is not the only one that has been the scourge of the earth over the millennia. There's been lots of plagues, lots of pandemics. The only problem is that it's only in recent times that any of these made their way into the books and the literature and the press. Tonight we're going to talk a little bit about how this pandemic, which seems so long ago, over 100 years, interdigitates with the pandemic that we're currently undergoing, and how some of the lessons we learned from then have been applied to the current pandemic. Some of the lessons were not learned. And I found it very intriguing how society reacted to both of these pandemics. So let's start out by talking about what kind of flu the Spanish flu was, and when did it really happen. They always talk about the Spanish flu of 1918, but in fact it started in 1918, but it wasn't officially declared an end until April of 1920. So it came in 4 separate waves. It turned out that this type of virus, which they couldn't classify at the time because they didn't have that expertise, was an H1N1 influenza virus of swine origin. And you might think, well, you know, I've heard about the swine type flu. And if you have, you're right, because as recently as 2009, we had a sort of a mini pandemic of swine flu that involved a number of countries on the globe. It didn't come to the same level or ever reach the same level as the COVID-19, but it's not a new virus. It's been around and it does have an animal origin, in this case, swine. But this pandemic was significant in one way. It infected nearly 50 million people worldwide. And that's a big number, especially when you think of the fact that the world only had 1.5 billion people. So it infected 1/3 of the entire world's population. And it killed anywhere, depending on what literature you read in the public health literature, could be as many as 20 or up to 50 million people. So 1 in 20, even if you go on the low number of that extreme, it killed 1 in every 20 individuals on Earth. Pretty significant. Just to make a comparison with our current COVID-19, the SARS virus, to date it has killed 4 million people. And we think of that as tragic, and in fact, you know, the news every night is talking about the death toll over the last year and a half. How many people were dying in India? How many people died in Italy? Totally, up until the recent months, 4 million people have died, but that's still much, much lower. It's 1/5 of what was the number of people who died during the pandemic of 1918. Of that 4,670,000 Americans perished in the flu. This is just a graphic that helps to show you one of the differences, though, between the pandemic of 1918 and our current. And what's intriguing about this is the age distribution. COVID-19, as we've all been led to believe, and it's very true, affects the very elderly. And so most of the deaths around the world have involved people between 45 and maybe 85 and over. But the Spanish flu, as you can see in the dark blue lines, it pretty much affected everybody. There was a large spike among young children and a large spike over here amongst the elderly. But there's also a pretty significant number of people who, in this age group, who died from the Spanish flu, who were not dying and are currently not dying, well, unless you think about the Delta variant, who are not dying of COVID-19. Why is this? Why would the Spanish flu affect the entire age distribution? Well, it's not really that specific. We can theorize that the very old were already probably impaired or infirmed in some way. The very young had a very immature immune system, so they might, in fact, be inclined to perish if untreated with an influenza type of a virus. But this middle age group is unique because the Spanish flu of 1918 was interdigitated quite significantly with World War I and all of the soldiers of World War I. And I'm going to explain further how that happened to interdigitate and how these two phenomenon of World War and a world epidemic or pandemic occurred at the same time. How many in this audience believe that this flu came from Spain? After all, it is the Spanish flu. Well, the fact of the matter is it did not originate in Spain. In fact, it probably shouldn't even be called the Spanish flu. Why? Because the very first recorded case, if you looked at the public health data, not so much the newspapers, public health data and records of that era showed the very first documented case was in Fort Riley, Kansas. So did the flu really originate in Fort Riley? In Camp Funston, which was a training grounds for soldiers who were embarking to go to the front lines of the trenches in World War I, they trained there and in many other places around the continental United States. It turned out that there were some additional cases reported in the literature showing up in the French and German literature only a month later. But why Kansas and why Fort Riley, of all places, to have the Spanish flu show up? Well, as I just mentioned, it's due a lot to the global effects of the World War, which began way back in July of 1914 and did not end until Armistice Day, November 11th of 1918. So you can see that the Spanish flu did interdigitate because it shared in common most of the year of 1918. Part of the reason that the flu came back to Kansas was because sick soldiers were evacuated out of those trenches and sent home. They might be sent back to Great Britain, or they might be sent all the way back to the United States, because this was the last year of the war. Things were winding down. Thankfully, the Allies had the upper hand at this point, but there was an awful lot of movement of soldiers and sailors back and forth between continental Europe, Great Britain and the United States. And what do you think the Army officers, the medical officers would do? Well, they would simply pluck these young servicemen out of the trenches, put them in the infirmary. If they were super sick, they would be evacuated back home. If they were borderline sick, they would probably be cared for and sent back to the trenches. But those soldiers who were being sent back home, how would they get back home? Well, they would travel on what? Trains. They would travel on boats. They would gather in train stations. They would gather on docks, all without masks, all super sick, all with this influenza, this virus that they couldn't pretty much eradicate in the infirmary back at the front line, so they'd be sent home. So just imagine, without wearing masks, without having social distancing of the era, you know, they were sitting next to each other in train stations. They were sitting next to civilians in some train stations. Sometimes they shared the same common modes of transportation. So it didn't take long for the flu, the virus, to find its way back to the United States, probably from the front lines of Europe. Another reason why we didn't hear much about it in Europe was because of the censorship of a lot of the newspapers. During wartime, they didn't want to let out a lot of information about casualties, about where the front lines were, where the troop movements were. And if soldiers were dying from the flu, they didn't even want to let the Germans know that. So a lot of that information was suppressed in the French and the British press. However, Spain was neutral during World War I. Spain had freedom of press, and they had, you know, correspondents, war correspondents, who would come and go and share information. So the newspapers in Spain would report about this flu that seemed to be ravaging a lot of the Allied troops back in the front lines. In addition to that, turns out that the King of Spain, King Alfonso XIII, came down with the flu. And this because the Spanish press made a big deal of it, spread around the world, whether it was the New York Times or the London Times. They were following how was King Alfonso doing back in Spain, and I guess it was nip and tuck for a long time, and people were kind of on the edge of their seats as to what would befall the King of Spain. So many of the news reports of the day would talk about the Spanish flu in Spain, that it infected the King of Spain and he might die from this Spanish flu. So it didn't take long before the rest of the press around this country and around the world began to call it just the Spanish flu. So even though it didn't really start in Kansas, and I'm going to tell you later where we think it really did start, it earned the moniker of Spanish flu, and that's stuck ever since. And incidentally, King Alfonso did survive. The press, as the flu began to spread in this pandemic fashion, exploded around the world. You can see here on the graphic many Spanish flu, many deaths. Epidemic influenza, Spanish flu is everywhere. It's showing up in the press everywhere. But in the early days, in the early months, there still were not a lot of public health preventative measures being taken, other than to report that it's a deadly disease. What were the characteristics of this flu, and how did it differ, if it differed at all, from COVID? Well, as I showed you in the early graph, it did differ in one sense because it seemed to infect and kill a lot of people between the ages of 20 and 45. Yes, it killed some people on the older end of the spectrum and some young children, but why all these young people? Was it that much more virulent than COVID-19? Well, it's not known for sure, but probably part of the reason is simply, again, the way it was transmitted. When you think about all these soldiers moving back and forth, they're congregating with other soldiers, other men and women of their age. Even if they got back to the States, they probably were sent back to forts and naval stations where they were going to be with other young men, and if they had a spouse or a girlfriend, they would be with somebody their own age. Not necessarily spending a lot of time in an old folks home or in a newborn nursery. So when you think about just the way it would disseminated without the mask mandate being in effect, you would see how it would begin to affect a lot of people of that age group. Moreover, these younger people tended not to seek out care. They were the strong, healthy type. If it was their young baby, the mother might take it to the doctor if it had the flu. If it was a rather older grandparent, they might take them to the doctor because they had the flu. But a lot of the people in the younger age groups just didn't go to see the doctor. They usually would recover from their colds and the flu. So they didn't go to the doctor, which was a critical mistake. And the reason it was a mistake was because it really wasn't the flu that killed these people. It was the pneumonia caused by bacteria that was opportunistic that came later. Most of these people around the world did not die from direct effects of the flu. They died from bacterial pneumonia. Why would that be? No antibiotics of the day. We didn't have penicillin. We didn't have all these wonderful medicines to treat these young patients. I'm not going to bore you with too many graphs, but this is just another one that shows you this age distribution up here. This one is total number of deaths, and you can see once again significant numbers between the ages of 20 and about 45. I found this graphic kind of interesting. This happened to come from Paris in their epidemiological studies, and it showed once again the spike amongst this age group between about 15 to 24 up to 45. But what was unique about this one is that the blue represents men who died, and the purple represents women. I found it very intriguing that many more women of this middle or younger age group died than men. And again, why would that be? Again, different theories. One might be that a lot of the men were in the military, and so they had access to the health care of the military system. The women stayed home. They took care of the children. Again, they didn't go see the doctor when they got sick. They felt they were going to get over it, but instead they got bacterial pneumonia and they died. So at least in the Paris healthcare records, it was very interesting to see that women died more than men in that younger age group. Another theory that I found kind of interesting was, I mentioned earlier that there was a swine flu in 2009 that traveled around the globe. But even back in 1890, there was a swine flu that was called the Russian flu. And it was also theorized that some of the older folks in 1918, who might have been in their 30s and 40s back in 1890, might have contracted the Russian flu back then and actually had some degree of immunity and antibodies to the upcoming Spanish flu. So that might be another reason why, even though some of these older folks were impaired, and many of them did die obviously, some actually survived because they might have had pre-existing antibodies. I think this is my last graph, but the only reason I put it in was because it happened to be one that showed the death toll in America, and this just happened to be a selected county. It was Pima County down in Arizona, which is where I think where Phoenix is. But once again, you can see this significant number of younger people, and by younger I mean 20 to 45, who were dying from this dreaded flu. Now, as I mentioned, this flu came in waves. The first wave was felt to occur between February of 1918 and April of 1920. This first wave was probably mostly due just to the migration of soldiers and sailors coming and going. Many of the sick ones being sent home, but they were still training soldiers in places like Camp Funston and Fort Riley, and they were being sent to the front lines in Europe. So again, you had this interdigitation of these soldiers coming and going, spending a lot of time on boats in close quarters, spending a lot of time waiting in train stations and on trains, infecting each other right and left. It wasn't, again, apparent at the time because, again, of that censorship of the literature, but later on, the studies of the medical records in the French and the British Army showed that 3/4 of all the French soldiers had been infected, and a half of all the British soldiers had been infected with this swine flu. There was no quarantine at the time, so again, no social distancing, no mask wearing, and so you can imagine how quickly this would spread at a time of war with all of these young men. And it was also unique because it was the first time really in modern times where there was a lot of travel between continents. The soldiers obviously coming and going, and the armaments and supplies also coming and going across the Atlantic. I just threw in this graphic because it's, if you can read it, I don't know, but it's, it happens to be from a naval shipyard. It says the Spanish influenza, you know, it has endangered, you know, and the prosecution of the war in Europe. So it says that they've already had 30 deaths at this naval shipyard. Spitting spreads the Spanish flu, so don't spit in this naval shipping yard. So I thought that was kind of interesting. You know, it's probably got a very clean concrete surface there. You'll find out later that spitting seemed to be one of the things that they worried about a lot in 1918. The second wave of the Spanish flu was felt to occur between August of 1918 and December of 1918. What made the second wave unique was now the soldiers were home. Many of them were not being redeployed back to the front lines. In fact, they were being discharged. Why? Because the war was going to end in November of 1918. They were being discharged. They were getting out into civilian society. So now, instead of kind of a linear progression, now you have this sort of exponential progression of the flu as it moves out into the civilian sector. And it spread very quickly through the United States, and it was actually the most deadly wave of all because it truly killed more people than any of the other waves of this dreaded epidemic. I just threw in the street guard because, as I mentioned, the soldiers traveling on their, you know, on the boats, and many of them did not travel with civilians, but they were all congregated. But once they did get back to the States, you know, these soldiers who had been discharged, they're on trolley cars, they're on buses, they're traveling in a lot of modes in which they're placed in close proximity with the civilian sector. You know, here we see, you know, high society has now at least gotten to the point where they're realizing that they need to protect themselves, so they're wearing masks. I found this one kind of interesting because it seemed to wrap all around her bonnet, you know, as well as her face. But they even got the Boy Scouts involved. They were wearing masks. They were putting burlap, you know, bread bags over drinking fountains. They were beginning to now realize how dreaded this disease was and beginning to take public health measures. I just took this one from Columbia, Missouri, because it kind of detailed retrospectively by looking at the newspaper and the health data what they did to combat the flu. And I'll read it if you can't, but it's, well, you probably can't. To stop the spread of the disease, the Board of Health here has ordered that all public gatherings be banned, schools, churches, and theaters be closed. Doesn't that sound familiar? Also, temporary hospitals, because the hospitals at the time were being overwhelmed. Doesn't that sound familiar again? ICUs. They didn't exist back then with that nomenclature, but the hospitals were being overwhelmed and they had to establish auxiliary hospitals and infirmaries in a lot of these cities. Things like football, very important to Americans, were canceled. And the age of the victim, you know, can see that they were already realizing that a lot of young adults were succumbing, which was really quite unique. It turns out, and this is all something that you've already heard from me, that it you know, killed a lot of people around the earth, but this particular evaluation, again, a retrospective public health evaluation, said as many as 50 million. Again, you know, the range that I read was anywhere from 20 to 50, but 20 is quite enough. What about the third wave? Well, what was unique about the third wave? Well, it's because now the spread had jumped away from Europe and, well, beyond Europe, beyond the United States, to to other countries, even Australia, more distant countries, as more and more travel occurred from boats to places like Africa, Rhodesia at the time. There were a lot of Brits traveling from Great Britain down to Rhodesia, now South Africa. And so now we begin this third wave with worldwide spread of the flu. Southeast Asia was very significantly affected. I'm not sure that this is the best graphic because it tries to show these waves by color, but it doesn't really, I think, tell the whole story. The first wave was in black, but it was mostly between Europe and America with the movement of soldiers. The second wave really was the one that involved civilians, and that's supposed to be represented more by red, but you can see it's now movement of civilians around the globe. And then lastly was isolated countries that you'd think maybe would be, if they had quarantine and embargoes, maybe they would not have had anywhere near the level of disease, but even some of the countries like Australia did finally succumb. And this is all happening now with the third wave of this Spanish flu. The fourth wave, the last wave, they felt and applied the dates January of 1920 up through April of 1920. What was unique about this last wave is that it really involved isolated pockets of infection. And these pockets existed in places that you might really expect, where people were still highly concentrated, poor areas where they didn't have access to health care, maybe areas where they didn't really believe the public health officials, and they didn't wear masks, like Brooklyn, New York, and it turns out that a lot of the immigrant areas of New York and Philadelphia, where there were high Irish and Italian concentrations, had these significant pockets of residual flu, even after the first three waves that subsided. Areas around this country seem to have still a high level of infection. Part of it was also because the public health officials were very geographic and almost down to the different cities had different levels of response to this flu. Philadelphia, for instance, was very lax. Didn't demand that all theaters closed, didn't demand necessarily that everybody has to wear a mask. Switzerland had some areas of concentrated flu. But unique about Philadelphia that I found kind of interesting was, the First World War ended in November of should have been 1918, or November 11th, and that's Armistice Day. Oh, but a year later, the city fathers of Philadelphia thought they needed to have a parade. And even though the flu was still pretty rampant, we're now like heading to the second and third wave, they decided that they were going to have an Armistice Day parade in Philadelphia. And wouldn't you know, they had a significant spike. Now this one shows it spiking in October, but that's because of the lax restrictions in Philadelphia even before the parade, which happened in November. But there should have probably been another spike right here because their public health measures in Philadelphia were totally different than in some other larger cities like St. Louis. It was closing down theaters and churches and public gatherings early on and requiring people to wear masks. And you can see that St. Louis had a far less death rate than did Philadelphia. So getting back to my original question to the group here, was it from Spain? Was it from Camp Funston in Fort Riley? Well, probably neither one. Again, hindsight is 20/20, and when you can start digging up these public health records and epidemiological records, it was found that there was a lot of flu going on amongst the ranks of these soldiers, even in 1917. There was a very large outbreak in this city in France that I cannot pronounce. And there was another rather large outbreak at a training facility in Rushmore, England. These soldiers were seriously sick. Many of them died, but it wasn't being reported again. And it's really felt that this was the early origins of the real Spanish flu, that these soldiers, the ones who did not die, went back to the trenches, where again the hygiene was quite poor, cold, miserable conditions in the trenches, and what they did was begin to spread the flu amongst all the other soldiers, especially those coming in from the United States. Another thing I found kind of interesting in my research was this part down here, especially when we now talk about COVID-19 and whether there could be origins, from Wuhan, China, with the bat origin theory. Well, it turned out that to build a lot of the entrenchments and dig a lot of the trenches and place a lot of the armaments along these front lines that didn't move that much during World War I, they brought in a lot of Chinese labor. In fact, they brought in some 96,000 Chinese laborers to help dig the trenches and build the fortifications. And one epidemiologist who reviewed a lot of the literature thought that maybe the flu actually came along with those Chinese laborers. Nobody knows for sure. So we now know that large troop movements, close quarters, played a significant role in Spanish flu. The other thing that I alluded to a little earlier was, what did people really die from? Did they die from the virus? No, they really ended up dying from the secondary bacterial infection. When you get a significant virus like H1N1, it certainly debilitates you. Your immune system, even though it's maybe good, is depressed. And so bacteria are very opportunistic. If they can find a foothold, a sick person whose immune defenses are down, they'll gain a foothold and they'll grow. And it's bacterial pneumonia that almost universally killed people. Again, you know, typically in modern day, when people got sick in the early stages, people in old folks' homes were quarantined, you know, and they were segregated. And the very young and people went to ICU. So when COVID-19 hit in this country and around the world, the immediate reaction, as you might guess, was to segregate these people and isolate them. Well, in a way, when you think about what happened with the soldiers, it was almost the reverse of that natural selection. Instead of isolating the soldiers, they spread them out into society. And as they moved out into society, they took the virus with them. What were the symptoms that the people would have? You know, we know kind of how COVID-19 has infected a lot of people, and most of their symptoms were very similar, because people back then would complain of a sore throat, headache, and fever. The lack of the antibiotics, though, was very devastating, because these secondary infections are what really they died from. Mostly staph and strep infections that might start in the throat and find their way into the lungs. In early stages, you know, the healthcare at that time was still pretty rudimentary compared to modern healthcare. A lot of the doctors would blame the sickness on things like the plague, typhus, dengue fever. You know, a lot of the people who were sick were given a diagnosis oftentimes in the early stages of anything other than the flu. Hygiene was poor worldwide, and certainly in the trenches of the front lines, and again, that really led to this opportunistic virus gaining a foothold. You know, I found this particular placard that I think was up in a British, not an American infirmary, that listed the most common symptoms that the soldiers were coming down with. And even though it's hard to read maybe this line over here, I can tell you that the most common early symptom was just the sudden onset of it all. Secondly was prostration. And we hear that with COVID-19 too. People say, I just felt deathly tired. I couldn't get myself out of bed. High temperature, again, very common, similar to COVID-19. Headaches, conjunctivitis. As an eye doctor, I can tell you that, you know, when you're blowing your nose and you've got snot running everywhere, it's pretty easy to get infections, you know, that find their way from the nose up to the eye. Coryza, just a simply runny, you know, nose and a head cold. And lastly, a cough. So these were the most common symptoms that were befalling these soldiers early on. What about the public health measures? Again, I already told you that they were very varied across the United States. In the early stages, they were totally lacking. When these soldiers were coming and going, and even after civilians got infected, they were still not in the early stages requiring them to mask up, and they were not closing down places of public gathering. But soon that changed, and it had changed rapidly. Face masks were beginning to be mandatory. Some places, some laboratories tried to make vaccines, but again, it was a futile attempt. There was really no good vaccine in the day because they really couldn't identify viruses like they can nowadays. And the vaccines that they were trying to make, which still were ineffective, were against bacteria. But I tell you, the public health arm of the United States and worldwide soon began to flex, and it became very common to see all sorts of things in the newspapers. People caught on to the fact that, you know, you've got to cover your mouth when you sneeze and when you spit, don't spit, and that it's good to wear masks, and that, you know, you've got to start closing down public places all over the place and not let people congregate. So we've been through that. However, did they close down the economy to the same extent as our economy around the world was closed down over the last 2 years? And the answer is no. Mind you, there's still a war going on. They still needed factories to work. They needed to move soldiers back and forth, but they needed to get provisions up to the front lines. And I can tell you that the United States economy did not close down totally. People still went to work. Yes, they wore their masks, but whether they were at a secretarial pool or whether they were plugging in, the phone lines as, for working for the telephone company, they went to work. Even in that naval shipyard, they went to work. But the press, well, it's all over the place. I mean, you could read things like, open-faced sneezers are going to be arrested. The flu curfew will sound out Saturday night. You got to get back home. But even though there were a lot of good, proper warnings about social distancing and how deadly was the flu, there were still a lot of, anti-vaxxers and anti-maskers back in the day. This just happens to, show another thing that's being closed, another place that's being closed under the order of the mayor. Places, like Bemidji, which I guess is Minnesota, is that right? They're closing down everything, and it's all happening at the same time as the war is winding down. I found it kind of interesting, again, I told you that the response was all over the board. On one side, it's kind of blurry, but we see the very beginnings of the American Red Cross is already mandating and telling them people to wear a mask. In fact, they were telling you how to make a double thickness gauze mask. They were giving you the dimensions of the mask and how to make your own mask. So this is happening over here, but these people probably did not make their own mask, but they probably thought that they were being very well protected, except for their mouths. You can see they can do a lot of breathing in and out, but whatever was coming in and out through the nose, it was covered. So there was a lot of misinformation going around. I'm glad that they knew that cough and sneezes spread diseases as dangerous as the poison gas of World War I. The gauze mask that I just showed you being pushed by the American Red Cross, people were going to make their own. But at the same time, you were getting things like this, where people were having an anti-mask meeting, a gathering at wherever Dreamland Rink was, in order to combat this decree by the local mayor that they had to wear a mask. Doesn't that sound familiar? So, did some of these people go to hospitals? Well, of course, and the hospitals were being kind of overwhelmed. As you saw in that one graphic, many times they had to create auxiliary hospitals using whatever space they could find. They didn't have any antiviral medicine. That was going to come decades later. No broad-spectrum antibiotics. So what did they get treated with? Well, this is about what they had of the day. They had aspirin, they had quinine, castor oil, iodine. They would kind of treat you with a poultice. They would try to get you over the initial stages of the flu, and if they succeeded and you didn't get a bacterial infection, you'd probably live. But the lethality of this disease was pretty significant, as you've already seen from the graphs. There's a bunch of doctors in waiting, for somebody to arrive at their hospital, and the same with the nurses are busy making their masks. But there was a lot of good information going around, again, just coughing and sneezing can spread the disease. Avoid crowds. If possible, walk to work. Avoid public places, especially mass transportation, which people did. Here's that spitting thing again. Don't spit on the floor of the sidewalk. They really thought that was problematic. Avoid excessive fatigue. And maybe they thought because one of those early symptoms, as I showed you earlier, was prostration and fatigue. By avoiding fatigue, maybe you could avoid one of the early symptoms of the virus. But finally, if taken ill, go to bed and send for a doctor. Well, again, we know that some of the old people and some of the young babies got sent to doctors, but a lot of those people in the middle thought themselves virtually invincible and they didn't go to the doctor. Again, you saw the mask that just covered the nose. Look at this contraption. Again, the knowledge of how the disease spread was still pretty in its early stages. This machine was supposedly going to take the evil vapors coming out of her nose and sequester them into this little box. I don't know what it did inside the box, but you could see that she could still breathe fine through her mouth. But this was supposedly a way of treating people by hooking them up to a machine like this. And once again, we see the spitting sort of showing up again. Spit means death. So boy, I tell you, people did not spit back then. If you were a tobacco chewer, you probably had to swallow instead of spit, I guess. I know it's redundant, but again, 50 million people died around the world. The total, 500 million, got infected worldwide, and 21 million probably died, maybe more. Interestingly enough, there were still geographic areas. I talked about the pockets in that fourth wave of the influenza. Well, the death toll was also very interesting and very geographic. For instance, in Europe, the death toll in France and Great Britain was much lower than places like Hungary or Spain. Spain didn't even have the war going on, and you'd think with all those soldiers over in France and England there'd be a higher death toll amongst the civilian population, but there wasn't. As you might expect, people who were low-income earners, who were in very concentrated urban areas where the disease could spread, were much more likely to get the disease and die. So people in urban areas died more readily than rural areas. This graphic just shows you where people died worldwide. The darker the blue, the more people who died. Interestingly enough, Mexico, had a very significant death rate compared to the continental United States, or the USA. Down here in Rhodesia at the time, maybe due to the influx of British soldiers coming after the war down to the southern part of Africa. Of all the countries in the world, India was probably the hardest hit. Obviously, very high concentration of people, but the death toll in India was phenomenal. And I believe, and I'm going to get to a slide on that, but I believe it was 12 million people. So more people in 1918 died in India alone, 4 times more almost than have died so far with COVID-19 throughout the entire world. So it shows you how dreaded this disease was. Everyday life was hampered. Stores and businesses, many of them did close, but many remained open. Mass graves were being dug by steam shovels at the time. Certain island nations, well, we know that Australia eventually succumbed, but smaller island nations like American Samoa did not have a single case or a single death. And that's because they basically quarantined the entire island. Just another to show you some of the press that was showing up worldwide and things that you would see day in and day out, in the headlines of your local newspaper. Well, let's go ahead and move from worldwide to Colorado, because obviously that's where we are right now, and you can't have an Evenings of History lecture without somehow drawing in Southwest Colorado. Colorado was not immune. I mean, Colorado developed and got the Spanish flu just like any place else in the United States. But what was unique here about Colorado, how did it get here? Well, as you might guess, it was brought in by soldiers. And before I launch into the next 3 or 4 slides, I do want to give some credit. Some of this information and data I got from soon-to-be published information compiled by members of our staff at the museum. We have Robert Stouffer and Marie Jones and Irene Mativi have put together, and are putting together, a small booklet on the history of our museum building. And that building has gone through a lot of different stages, from being a hospital to being an infirmary to being a doctor's office and place of business. Doris Gregory wrote about a 20-page pamphlet on this a few years back, maybe 20 years back, but Robert and the others have embellished upon that to include biographies of all the doctors who are served over at our hospital building, all the births and deaths, I think, that might have been recorded, and a lot of the other information that was not compiled. I think they certainly have a chapter or 2 on how the Spanish flu did affect the city of Ouray. So some of this information came from them, but the Spanish flu arrived in Colorado from soldiers that came down for training to Boulder and Colorado Springs in September of 1918. They came here from Montana, from one training area to another, and they might have been going to CU Boulder to learn linguistics or something like military intelligence. It wasn't necessarily in-field exercises, but they brought with them the flu because, again, soldiers are moving back and forth to all these training grounds in the continental United States. They were sick with the flu, and it spread very quickly through the Front Range of Colorado because of this movement between Boulder and Colorado Springs. So on October 16th of 1918, the governor at the time, Governor Gunter, closed all public and private gatherings in the state, a pretty draconian type of decree. But did all of Colorado listen? Well, maybe not necessarily, but one city did listen. In fact, I single out Gunnison because not just amongst cities in Colorado, but perhaps amongst a lot of the cities in the continental United States, they probably had one of the most stringent isolationistic approaches to the disease and quarantining of their city compared to almost any other place in the country. In 1920, they had a population of around 1,300 in the city and 5,000 or 5,500 in the county. They are connected, by 2 train lines, or were connected, and Highway 50 that comes over Monarch Pass. And so what the Gunnison newspaper was saying in October of 1918, as the pandemic was rising significantly in this country, is that the flu is after us. It's circulating in almost every village and every community around us. They went on to say that our city has got to do something about it. And so they had some town officials, totally unlike Philadelphia, who took immediate action. They wanted to quarantine against all the world. And so what they did in Gunnison was they began to erect barricades up on Monarch Pass and kind of near where Blue Mesa Reservoir is now. They restricted travel coming in on Highway 50 by automobile traffic. They also set up barricades around the county for people coming in on county roads. They closed their schools, their churches, they banned parties and street gatherings. The county was really locked down for a period of about 4 months, and it worked. Because after the first 2 waves that happened worldwide, Gunnison still had no cases. Can you believe that? Why was it so successful compared to the rest of the United States? Well, it was because it had good cooperation between a couple of doctors in town as well as the local government. The newspaper took an active role, and the police took an active role. One doctor, a family practitioner, Dr. F.P. Hansen, was one of those leading physicians. He issued very strict quarantine measures. He was the one who told them to put up barricades and fences along all the county lines of access. Because they didn't have illuminated lights at night for people coming in on Highway 50 in automobiles, they put lanterns up with these signs, and they had sheriffs there to stop them. They had to make sure that they were going to travel all the way through without stopping. And if they did stop, they'd be arrested. Passengers who would disembark from the trains were all immediately taken in quarantine for a number of days or weeks. So as you can see, these are pretty significant measures. The quarantine measures for Gunnison read, and I'll read it for you if you can't read it all up there, but only leave your homes as an absolute necessity requires. Keep your homes well ventilated and admit the sunshine. For the present, there shall be no gatherings or meetings of any kind, no services in churches, and no lodge meetings. There shall be no schools, either public or private, of any number greater than 4 people. There shall be no theater or place of amusement or entertainment open to the public. Signed, Dr. J.W. Rockefeller. He was the other doctor in town who was just as strict as the first doctor. I'll wager that a lot of the streets of Gunnison, this was taken in 1930, were probably just as deserted as this one looks to be, because people were staying in their home. And at the same time as this was happening in Gunnison, there were newspapers out on eastern plains of Colorado that had things like this: eat more onions, one of the best preventive measures for to stop the influenza. So you could see how different it was from one state to another, from one city to another. Because Gunnison was, again, pretty draconian in their measures, but it worked. But I'll bet you this helped, onion sales elsewhere, in the state. This same Dr. Rockefeller, who I just quoted there, he was also given full control of, he was actually the direct linkage with the police and the sheriff. When residents would report somebody sneaking in, either getting off the train without being quarantined, or motorists who said they were going to travel all the way through but didn't and stopped, they'd get arrested. And they really had the public, or at least the people of Gunnison, tattling on each other. They were all looking out their windows, and they were going to report anybody who didn't obey the rules. But by late February of 1919, the number of cases in Colorado had begun to ebb, and so the governor began to reduce his his edicts, and more theaters opened up, more and more public gathering places opened up. And wouldn't you know, as soon as Gunnison followed those orders of the governor, some cases did begin to show up within Gunnison, and on that third wave, there were reported 100 cases over about a 6-month period, all of which survived. So still the death toll in Gunnison compared to many other cities in this state was quite low. What about Uray? I'm going to bring it home now. Finally, Uray. Here's our hospital, and I'm sure it was full during, to capacity during most of those months of 1918. The Sisters of Mercy, in fact, they brought some up from Durango to help care for the sick and infirmed in our hospital. In fact, one sister, I'm going to quote her a little bit later, was talking about there being 2 hospitals in Uray that they were treating patients with the flu, so I'm going to guess that some other facility, either in one of the mines or within the city of Uray, was transformed into another kind of field hospital. The newspapers at the time were probably just as diverse as they approached the flu as were some of the cities. I'm going to read you this quote from the Rocky Mountain News of October. And it applies to the city of Uray, and it reads, and this is suggesting that Uray, was kind of like Gunnison, that this was a safe place to be because the quarantine was working in Uray. But it might not have been working so well in Telluride or in Silverton because the situation in Telluride and Silverton is the nearest approach to panic that has yet been reported. Here the miners are fleeing from the Sunnyside mine in unreasoned terror and are headed to Uray, where a strict quarantine has kept the town free from the scourge. Guards were sent out to intercept the miners at the Red Mountain Divide, and late last night a pitched battle between the guards and the miners seemed imminent on the pass. The Highline Trail leading from Telluride and all roads leading into Uray are under guard, and all auto traffic is suspended. The report from the other mining camps surrounding Uray are said to be alarming. So here you have these miners fleeing the mines of Telluride and Silverton, coming to Uray because supposedly it's safe here. Well, I'm not so sure it was that safe, because I can tell you for a fact they didn't clamp down anywhere near the way Gunnison did. In fact, let's read a quote from a newspaper near the same time. This happens to be the Durango Herald. And it says, the lockdown in Uray was not, I put that, the lockdown in Uray was not as tight as Gunnison. But the newspaper said, the town of Uray, the gem of the Rockies, that has maintained a shotgun quarantine against the influenzas, is today reported to be terribly stricken by the dreaded disease. Last night, there was reported 150 cases in town and 60 cases at Camp Bird. So the miners might have been fleeing here, but it wasn't necessarily a whole lot safer here. Although the good town doctor did do something early on to try to minimize the spread. Dr. Rowan, who was the city physician at the time, asked the city council back in the early part of 1918 for permission to begin fumigating the city of Uray, and they gave him permission. And so he went ahead and had his people do the fumigation. Later that year in November, he was still unpaid for that, and he wrote a letter, and I thought I'd put this in because it's just funny. The letter to the city fathers reads, "Sir, the action of the city council in refusing to allow my bill for services for the fumigating rendered to the people of Uray and the Board of Health warrants my tendering to you my resignation as your health officer. I cannot live on wind. The same to take effect at once, trusting that you may find a more capable and efficient officer." So there were some measures being taken in Uray. They were stopping some people getting off the train. Not everybody was quarantined. Miners, as you could see, could come and go, whether from Silverton or Telluride. But there were certainly a lot of cases in Uray, and it did fill up our hospital and this auxiliary hospital. Let's look at some newspaper articles from our paper here in Uray, the Uray Herald. It turned out that a lot of the reporting on what was happening with the flu ended up in the social column, in the personal, socials, and small locals column of the newspaper. Items like Mr. John Foreman returned to the mountaintop mine after 5 days of quarantine at home. Other articles that said the Camp Bird people are receiving more than their share of influenza. The mine is closed, and every effort has been made to stamp out the disease. To date, some 35 or so cases are reported, but all are getting along nicely. So that group of the Sisters of Mercy that I showed you, one sister, Sister Mary Gerard, was the one who came up from Durango to assist, and she at the time was quoted as saying that the 2 hospitals in Uray are filled with nothing but pneumonia. There's that pneumonia again, because that's what the people were dying from. This Dr. Bowers, I don't think was a local doctor, but again, to show you kind of the quackery that was going on at the time, it's probably one of my last of these newspaper articles, but let me just again read what Dr. Bowers had to say on the Spanish flu. And this was published, though, in the Uray Herald. So this is what the people were reading. Avoid crowds, coughs, and cowards, but fear neither germs nor Germans. Take a vegetable pill every day, Dr. Pierce's pleasant palates. If there is a sudden onset of what appears to be a hard cold, one should go to bed, wrap warm, take a hot mustard foot bath, and drink copiously of hot lemonade. In recovering from a bad attack of influenza or pneumonia, the system should be built up with a good herbal such as Dr. Pierce's Golden Medical Discover, made without alcohol from the roots and the bark of American forest trees. So this is sort of the treatment that some people were getting. Thank God in some cases people recovered despite this, and the pneumonia maybe didn't kill all of them. Lastly, I just thought it would be interesting to show what showed up in the Uray Herald November 14th, 1918. This is 3 days after the Armistice Day, 3 days after the war ends. Wouldn't you know, it takes 3 days for the news to get back to Uray. It says in the headlines of the Uray Herald, World War I ends, the Kaiser abdicates. On the very same page it says, influenza situation in Uray serious, but not alarming. And so maybe at that point the flu had come under control in Uray, and thankfully it eventually came under control through the rest of the country. But whether we reached herd immunity or whatever, I don't know. But it didn't linger much longer. It lasted till 1920, but things pretty much got back to normal thereafter. So that concludes my topic, but I'd be more than happy to entertain any questions. Thank you.
Anyone have any questions?
Yes, sir.
Yeah, I was wondering, when you mentioned Silverton, the problem that they were having, the people panicking, everyone coming to Uray. What was the death toll? Because it seems like in the cemetery over there, there's quite a few that are contributing to the epidemic.
Yes, for those who didn't hear, he's asking about the death toll of the flu in Silverton, because there's an awful lot of gravestones that have death dates in 1918. You know, I didn't ever see an exact number, and I don't know if Robert Stouffer or the other people here who were writing the book on our hospital came up with that number. But I do know it was significant, and I think, if anything, I just read a percentage of a population, you know, a list of the mining population, that something like 1 out of every 5 miners, you know, died during that time. And Silverton was very hard hit, as was Telluride. I think that's why that Rocky Mountain News article showed them fleeing, and you would too, especially if you thought that there might be better health care and better public health measures being employed over here in Uray. Yes, sir?
Was the second hospital in the U.S.?
That's just it. All I got was the quote from the sister as to the second hospital. They never mentioned where. I'd probably have to do some more research. I'm sure it could be found out. I don't know if they transformed one of the other buildings into a makeshift hospital, which was very common at the time, or if they maybe made a large, kind of like field hospital in one of the mines here. That might be the other possibility. Any other questions? Yes, sir.
What would they use to fumigate?
What would they, honestly? I didn't even want to get into that. It's chemical warfare on both sides of the Atlantic, probably. Whatever it was, I bet it wasn't good for your health. It might kill the bugs. It probably didn't do anything for the bacteria, though. Any other questions? Well, you've been a very attentive audience, and thank you for your time. Thank you.